with Hawaii Health and Harm Reduction Center, which is a mouthful, I was curious because originally I was looking for to have on the Life Foundation, but then I found out that Life Foundation and HHHRC merged together. So can you give me a little background as to how that happened and what that meant for your organization as a whole with Hawaii Health and Harm Reduction Center?
Just rolls off the tongue, right?
Yeah, yeah.
So Hawaii Health and Harm Reduction Center, which a lot of people just refer to us in the community as H3RC, so like three H's RC,
Well, I wish I
was
knew
the
that in
product of a
advance. I would have
merger.
used that.
Yeah, 3RC. It's so much easier. Um,
Yeah.
it's the result of a merger of two longstanding nonprofits in Hawaii. Like you said, Life Foundation, which was started in 1984, and the Chow Project, which was a statewide needle exchange, which started in the early 90s. So in July 2018, the two agencies merged together to create the Hawaii Health and Harm Reduction Center. We
Oh, I
kept
see.
all of the same services that Life Foundation offered, all of the HIV care, case management, testing, LGBT services, as well as the Chow Project, because all of the statewide syringe exchange and everything like that, we kept that. And the result started because, I mean, it's such a long history, but the needle exchange started as a program of Life Foundation before it branched off into its own nonprofit of the Child Project. So it was basically like a homecoming for us. Also, we were already sharing office space. The Child Project was renting some office space from the Life Foundation. And the Life Foundation longtime executive director of 25 years was retiring. So Life Foundation was in search of an executive director. So it really was like a perfect fit. And the executive director of the Child Project had been working in the HIV field since the early 90s. So she was a perfect fit to take over both agencies and merge it together to result with Hawaii Health and Harm Reduction Center. So all the
Wow,
same
that's so
services,
perfect.
streamlined, one-stop shop for everyone right here in our offices.
So as far as what the focus is of H3RC and who they help support, what is I guess the focus of the organization?
We basically look to support and serve anyone, but we really try to support and serve the underserved populations. So we do a lot of work still with the LGBT communities. We still do all of our HIV, STI testing and whatnot, but we also have a great focus on the unsheltered community. So we do a wound care program specifically designed for them, where we have two APRNs that go out into the streets of Chinatown twice a week and actually do street-based medicine right there in the streets and see patients. We've also opened a free clinic in our offices that people can come in and walk into. So anyone that is unsheltered or anything like that that can come in as having a medical condition can come in, and our APRNs will see them. If they can't handle it, they will refer them out to a specialist or the hospital emergency room if necessary.
Now, it sounds really necessary for especially our community with all of the needs. But with COVID-19 and the whole pandemic going on, how has that affected your organization and the ability to help service these deserving communities?
Um, Hawaii Health and Harm Reduction Center never actually closed due to the pandemic, so we were deemed an essential agency, and so we stayed open throughout the entire pandemic. We
Oh,
did have to kind of change things up as to how we offered services. So, for example, HIV testing, we used to be drop-in testing, no appointment necessary, Monday through Friday, 9 to 4. During the pandemic, we started a whole new program of at-home testing. So we actually went out and purchased these self HIV test kits that we were able to ship out to people for free, and they would do over the phone counseling with one of our HIV testers and counselors, and then they would do the counseling portion before we sent in the test. They would do the test themselves, and then we would follow back with them. So that was one way that we kind of just shifted what we are doing to kind of meet the pandemic. Other than that, we continue to do our street-based wound care every Tuesday and Friday out in Chinatown. Obviously with added PPE for protection, but We continue to do that. We continue to see clients by appointment for the wound care clinic in office, but all of the standard procedures like temperature checks and pre-screening for COVID, like all of that's been in effect since the beginning.
Oh,
Um, so-
fantastic.
Something else that we've started since COVID is we've expanded our food distribution program. So last fall, we started a program where we did once a month, partnered with Hawaii Food Bank, doing like a food distribution based out of UH Manoa, but it was open to the public. Anyone could come and they could come and get free produce, fresh fruit, breads, things like that, perishables. And so that was happening since all of last semester during the fall. And then when the pandemic happened, UH shut down. So our
Oh,
program was kind of
yeah.
like, okay, what are we going to do now? So what we did was we partnered with other local um, private property owners in the area, and we started doing food distributions all over the island. So we do one in
Oh,
Kaka'ako twice a month. We've been doing Pupukea on the North Shore once a week for the past couple of months, and we've been doing Windward Mall once a week for the past couple of months.
wow, that's awesome. I love that it's all like fresh produce and healthy things.
Yes, no, it's an amazing program that the Hawaii Food Bank already had in place. It was just really expanding upon that. And so, and it was a really interesting time because with the Hawaii Food Bank and these food distributions, you're seeing people coming in during the pandemic that maybe have never accessed food bank in their entire life, never thought they were going to have to access food bank. Like they were driving up, they're like, I don't know how to do this. Like, what do I need to give you? I've never had to do this before. And so it was really heartwarming to be able to help these people during their time of need. And I think it was also eye-opening to a lot of people that about the different services that are out there for people.
That's really great that you guys were able to continue with your services and help the community during this time, especially during this time. Um, has there been any difficulties as far as, because it seems like that's kind of the reason why we're doing this segment is that a lot of our nonprofits who are so essential to the community are having a difficult time because of the COVID crisis, where the support that they're usually getting, whether it be through donations or volunteerism, it's been harder to get during this time. Has there been any difficulties that your organization has had to face during this time?
I think everyone's going through because of COVID, like budget cuts. Like we read in the news every day about what the state legislature is going to be cutting billions of dollars from the state budget, and anyone that receives any kind of funding from the state is um, going to probably be expecting budget cuts. But we've been very fortunate that personnel-wise, we have not been affected. We services wise, we're still continuing. I think because we were able to continue and provide all the same services, just in a different kind of format, that we've been very fortunate.
Oh, good. I, I found it interesting that you have such a focus on HIV testing and it's kind of, it seems like it's been like a kind of the forgotten thing because for a long time there's so much attention brought on to the battle against HIV, and then it seems like there was less attention brought to it. What has what has been kind of the things that you have seen that you would want the public to know more about, bring more awareness, more education about what's going on with HIV, the battle for it, and what our communities are still facing with this?
Um, by no means is HIV over. Funny you should say that because I think a lot of people, that's a lot of people's conception is that
Yeah.
HIV was a thing of the 90s, like we won the battle, we're done, whatnot. But the truth is, like, people are still becoming infected to this day, and to this day, we still don't have a cure. It's not the death sentence as that it once was, where people can live a long average lifespan on HIV with HIV, but the thing is, they're going to be on all these different medications for the rest of their lives.
Mm.
So by no means do we have a cure, but there's been so many medical advances in the past, and one really great one that's been helping the LGBT community immensely has been the introduction of PrEP, which is PrEP. PrEP stands for pre-exposure prophylaxis, and what it is it's a once a day pill that is almost like birth control for HIV. So if someone is HIV negative and they are on this pill and they take this pill once a day, their chances, if they are exposed to HIV through intercourse, their chances of contracting the disease is like reduced by 98%.
Wow.
Yeah. So here at Hawaii Health and Harm Reduction Center, we have an entire program around that. We offer wraparound services. So someone can come in, get their HIV test to make sure they're negative, get STI screening, which is the second part of the PrEP. We have a nurse practitioner on site that can prescribe the PrEP and see them and go through the whole process. And then we have a great partnership with a local pharmacy that will get them their medication.
That's awesome.
Yeah.
That's really great that they have these advancements that make it a little easier to protect yourselves and be taken care of.
Yeah, and if you think about it, the more people that are on PrEP, the virus can't transfer to any new host. So eventually, the virus, we may be seeing the last generation of HIV, people living with HIV.
Wow, that would be fantastic. Now, I know that a lot of the programs that you have are focused on supporting the LGBT community.
Mhm.
What other programs or services do you have? And especially that being Pride Month, I think there's a lot of focus and awareness around the community right now. So this would be great to talk about.
Yeah, we have many of our programs that we offer are all LGBT inclusive. One, for example, is the Kua'ana program, which is our transgender services. So Kua'ana literally in Hawaiian translates to the relationship between older sibling and younger sibling. So we have a group of peer navigators that work with the transgender community, and they'll help them with their name change process, resume writing, getting ready for the workforce, what to expect when you go to school, knowing your rights when you go into the workforce, all of these things. And so we offer that services for the transgender community. Specifically LGBT focused, we also offer a smoking cessation program. So it's called Hawaii's Last Drag, which is kind of a cute name, right?
Yeah.
So it is specifically focused to help those in the LGBT community that are ready to quit smoking. We help anyone that's ready to quit smoking, but it's really, the program is written to help those in the LGBT community. We provide counseling services from our tobacco treatment specialists. We provide free gum, lozenges, patches, things like that. So when someone's ready to quit smoking, like, they can come to us, and all of our services are free.
Is there anything a part of that program that is geared, like as far as the type of help is, I guess, focused on things that are more specific to the LGBT community, or is it just that because you want to make sure that that community has the support for
We
smoking
really want to make sure
cessation?
that that community has a support, because obviously there are a number of different tobacco quit lines in Hawaii and whatnot.
Hmm.
But we really feel like that the LGBT community needed someone specifically for them, that were there to support them.
I see.
And so we
I
work with
think.
all of the local nightclubs and bars,
Oh,
um, the local LGBT center in Waikiki. Like, we work with everyone in the community that we can to we go into treatment centers to try to really reach as much of a population as we can.
oh, that's awesome. And I think that the trans services that you have are I didn't even think about that, but yeah, like where would you go to learn about where you go to do the name change
Mhm.
and all of those different things that we take for granted that we just assume like, oh, must be easy, right? But no, there's a lot of things you don't know and don't have access to.
I had no idea until I was a volunteer with Life Foundation for 10 years before I started in my role here. And I had no idea of the extent of all these different services. Like the Cool Honor program, I never thought about it either. Like, when you pull out your driver's license, like the fact that has a gender marker of, if you're transgender, male to female, to have the gender marker on your license say female, and for it to have your female name, is so important to someone's like emotional stability. So I
Right.
And it's such a long process. Like we have peer navigators that specialize in this, but it goes through the lieutenant governor's office and all these different things that they have to do to change their documents. And then
Wow.
after that, when you are ready and you're transitioning, like think about it, like a lot of people going out into the workforce, like we see all the discrimination that's going on in the world today, like to know your rights and to know what you are entitled to as a human being, really, like
Yeah.
to be feel safe in the workplace.
You said that you were volunteering for 10 years before actually getting hired and joining. What was it about the organization and the work being done for someone to volunteer their time, that means they have a real personal connection as to the mission or the work they're doing. But for someone like yourself to do it for so long, what was it for you that was so important that you be involved with this?
I think as a young gay man, I was thinking that HIV was really one of the biggest problems in our community. And obviously, Life Foundation was the largest and first HIV organization in Hawaii. So anytime I was able to help them with the Honolulu AIDS Walk or anything I could do on the side, like I was always down to help. So to me, like it hit personal because just being around with my friends, these are the conversations that we were having with each other. Like when we
Mm,
were in college and whatnot, even though none of us were connected to the Life Foundation yet, all of us were having these conversations personally as far as like, oh, like what would happen if we got HIV? Do you know anyone with HIV? Do you know how it's transmitted and all these different things? So for us, I think that it really hit close to home with the HIV epidemic.
and how long have you been officially working with, I guess, H3RC?
HHHRC. I've been with them for 2.5 years.
So I think for most people who are working in nonprofit organizations and things such as yourself, that it's not necessarily about the money, but it's more about the experiences and the personal connection to the organization and the community that you're serving. Have you seen or experienced anything in your history there that really stood out to you that was like, this is why I do what I do, or this is why I'm here?
That's that's so hard to say because I see, okay, it's two parts. So I do all of our events. I do events, fundraising, and things like that. So I don't a lot of times get to work directly face to face with clients on the front line. But at the same time, like I help out everywhere where I'm needed.
Mm-hmm.
So just some of the events we've had, we do prior to COVID, we were doing like quarterly health fairs for the houseless communities. And we would bring together all these different providers of dental providers, health insurance providers, vision providers, and we would host them at a church. And then we would tell people that we're having a party, like, hey, come to our party. Because if you tell people come to a health fair, no one's going to come. So we would tell
Right.
people, like, hey, come to our party. And we would have like 60 or so people that were living out on the streets come and they would get access to services of like linked up to dental appointments. They would get free reading glasses from different nonprofits. So really kind of that's one of the things that HGRC was doing prior to COVID. We haven't been able to restart that yet, but that because I got to play a first-hand role in that, that was really quite amazing to see like all these people get linkage to services. Our syringe exchange services, like working in the syringe exchange van, like at where people come and bring us their used needles and we'll exchange them one for one, like that. When you see the face of who's exchanging the needles, that to me is very, very powerful because you see people from all walks of life. You see people drive up in their really nice cars, jump out, like exchange so many needles, and then you see people
Mm-hmm.
that probably slept on the street last night coming up to exchange needles. So you see people from all different walks of life. And so
Wow.
that to me was very powerful. And I think I like to think that my role in playing in the background of doing these events and doing fundraising and things like that allows these people to continue to access services or at least plays a part in helping them continue to access services. So that to me is super important. And like you said, we aren't here for the money, that's for sure. But
Yeah.
the great feeling that you get to have when you go home is indescribable.
Now you said that you're in charge of your events and such, and with the current state of how things are with COVID, have you do you have anything planned as far as some different types of events or things to bring awareness that that people can help support or volunteer, or and is there any way that others listening to this or watching this can help you?
Um, as far as volunteers, we've been really kind of limiting volunteers just because it goes through a little bit of a vetting process as far as like exposure. Have you traveled? Do you live with someone that's traveled in the last 14 days? So really we try to limit our volunteers, but some things that we have been utilizing volunteers for is we've been making homemade cards for all of our housebound HIV clients. It just so happens that a lot of our HIV case managed clients are of an aging population.
Mm.
So a lot of them live alone. They don't have a lot of family around them. And so isolationism is really like a thing. And so we've been trying to do handmade cards and whatnot. And people have been very generous. Like they've been creating them at home, creating them with their kids and sending them to us. And we've been sending those out to our HIV clients, which has been really, really awesome.
Oh, that's so cute.
Yeah. Other things we've been doing is we've been doing asking volunteers to do like hygiene drives of like any kind of like miniature shampoos, conditioners, things like that, that the hotels that you would have collected in your travels. Those are perfect for us that we give out to our unsheltered population. And they love travel size because oftentimes they don't have a lot of bags to carry around in. So little travel size stuff is perfect for us.
Oh, neat. Do you guys have any plans for of doing maybe some virtual events or things like that?
Yes, so we're in the talks of doing we're thinking about doing a couple of different things. Right now we're looking at August is International Overdose Awareness Day. So we're trying to find a way that we can turn that because we normally do a memorial where we remember all the different people that we lost to overdose in the past year. And that happens every August on the 31st. And so we're looking for how we can take that and turn it into a virtual event. So that is the one that we're mainly working on right now. And then in the fall, we have a couple of different events, Transgender Day of Remembrance, which happens in November, where we remember all of our transgender brothers and sisters that were killed from violence in the past year.
Mm.
And then every December we celebrate World AIDS Day. So I mean, it's a new day and age with COVID-19 and being an events
Yeah.
person. Like my job description just went completely out the window, and I'm like trying to write it right now into what it looks like today.
Well, you definitely have your hands full, but I think that what you're doing is so important, and I see what you've done in the past with different events and such, that you guys are so creative that I know that it's going to be really neat what you do come up with. So, and if anything, if the creative style you have for your physical appearance matches anywhere close to the creative style that you have for your events, you guys are in great shape.
Thank you.
Is
Thank you.
there is there anything that you would want the public to know? Maybe like your ideal way of them being able to connect with you or learn more about the program?
Yeah, if anyone out there is ever interested in anything H3RC is doing, you can go to our website, hhhrc.org. Also, we're very active on social media. So basically, everything that's coming up, events, fundraisers, anything like that, we try to keep very active on social media. So always follow us on social media, Instagram at HHHRC underscore and Facebook Hawaii Health and Harm Reduction Center.
Oh, the Facebook's got to catch up and shorten the name. Well, Andrew, thank you so much for your time, and thank you for everything you're doing to with your organization and helping our community. I just absolutely love what you're doing as a organization, and it's been really great learning more about H3RC. I mean, just hearing about all of the programs you have is just really fantastic. Thank you so much.
Thank you. Thank you for having us, and thank you for giving us this outlet to kind of share what we're doing. We appreciate it.